The COVID-19 pandemic may no longer dominate headlines the way it once did, but its lingering effects are far from over. Across the globe, millions of people are still living with symptoms that have lasted months or even years after their initial infection. This condition, now widely known as long COVID, has become one of the most complex and misunderstood post-viral illnesses of our time. In 2025, long COVID is no longer a fringe issue, it is a public health concern with long-term implications for individuals, families, and healthcare systems. Imagine recovering from what felt like a mild bout of COVID-19. You isolate, you rest, and you get through it. Weeks pass, and the virus is no longer detectable in your system. But something's wrong. You still feel exhausted after simple tasks. You can't remember names or concentrate the way you used to. You notice your heart racing after walking a flight of stairs. The worst part? Every test comes back normal. You begin to question whether it's all in your head. This experience is the reality for many suffering from long COVID. Their lives have changed in ways they never expected, and the road to recovery is often unclear. What exactly is long COVID? The term refers to a range of symptoms that persist well beyond the initial infection, usually for weeks, months, or even years. These symptoms are not caused by the virus being active in the body, but rather by the aftermath of how the body responded to it. The World Health Organization defines long COVID as a condition that occurs in individuals with a history of probable or confirmed SARS-CoV-2 infection, usually within 3 months from the onset of COVID-19, with symptoms that last for at least 2 months and cannot be explained by an alternative diagnosis. The symptoms of long COVID are wide-ranging and affect multiple systems in the body. Fatigue is one of the most reported issues. This isn't ordinary tiredness, it's a profound, debilitating exhaustion that rest doesn't fix. People often describe it as hitting a wall, where their energy just disappears. Then there's brain fog, a term used to describe cognitive dysfunction. People struggle with memory, focus, and processing information. Tasks that were once second nature become overwhelming. Others experience shortness of breath, chest pain, irregular heartbeat, joint pain, and even gastrointestinal issues. In some cases, symptoms may flare up after physical or mental exertion, a condition known as post-exertional malaise. Doctors and researchers are still trying to understand why long COVID happens. One theory suggests that the immune system stays activated long after the virus has cleared, continuing to cause inflammation and damage. Another theory involves microclots, tiny clots in the bloodstream that can block oxygen from reaching vital organs. Some experts believe that remnants of the virus may linger in the body and keep triggering an immune response. There are also neurological theories that propose damage to the nervous system, which could explain symptoms like brain fog and dizziness. What's clear is that long COVID isn't a single illness, it's a syndrome that may result from multiple overlapping causes. The people affected by long COVID are incredibly diverse. Some had severe cases of COVID-19 and were hospitalized, while others experienced only mild symptoms and recovered at home. Many were previously healthy, active individuals with no underlying conditions. That's part of what makes long COVID so frightening, there's no clear predictor for who will develop it. It doesn't discriminate by age, gender, or fitness level. Even children and teenagers have reported lingering symptoms months after infection. As of 2025, an estimated 1 in 10 people who contract COVID-19 may go on to develop long COVID. That's millions worldwide still battling invisible symptoms long after the virus is gone. Living with long COVID can be incredibly isolating. Because the symptoms are often invisible and fluctuate, people around them may not understand the severity of what they're going through. Employers may lack accommodations. Friends may stop checking in. Medical providers may be dismissive if standard tests don't reveal anything obvious. This lack of understanding adds an emotional burden to an already difficult physical condition. Depression and anxiety are common among long COVID sufferers, not just because of their symptoms, but because they feel unseen and unheard. This has led many to seek support groups online and in their communities, where they can share their experiences and find validation. In the face of so much uncertainty, what can people with long COVID do to heal? While there is no one-size-fits-all treatment, many healthcare providers now recommend a multidisciplinary approach. This might include physical therapy to gradually rebuild strength, cognitive therapy for brain fog, and dietary changes to reduce inflammation. Pacing is also essential, learning to balance activity and rest to avoid crashes. Some patients have seen improvement with medications aimed at controlling symptoms like heart rate or pain, while others explore alternative therapies like acupuncture, meditation, or nutritional supplementation. The key is to listen to the body and avoid pushing too hard, which can make symptoms worse. At the same time, researchers around the world are racing to understand long COVID better. Clinical trials are underway to test new treatments, identify biomarkers, and develop standardized diagnostic criteria. Governments and health organizations are beginning to allocate more funding toward long COVID research and support services. Advocacy groups, many led by patients themselves, are demanding recognition and resources. The medical community is slowly shifting from skepticism to support, acknowledging that long COVID is real and deserves serious attention. Still, much work remains to be done. In the meantime, raising awareness is one of the most powerful tools we have. People need to know that long COVID exists and that those suffering are not alone. If you or someone you know is experiencing persistent symptoms after a COVID-19 infection, it's important to seek medical advice and explore support options. Track your symptoms, rest when needed, and connect with others who understand. Healing may not be linear, but with patience, support, and the growing body of research, recovery is possible. Long COVID in 2025 is a reminder that even as we move forward from the pandemic, its shadows still linger. But knowledge is power. The more we understand, the more we can help those affected reclaim their health and their lives. This isn't just a health story, it's a human one. And it deserves to be told. If you found this video helpful or know someone who might benefit from this information, don't forget to like, share, and subscribe. Let us bring more light to this hidden side of the pandemic and support the millions still on their journey to healing.